All right, good morning, everybody. So this is just going to be a tutorial video going over some of the models that unfortunately I was unable to let you guys have any hands-on time with. But we're going to go over some of the bones we've talked about as well as some of the landmarks. So let's start with cranial bones first of all on this skull that I have right here. Of course, the first major one that we see is the frontal bone, represented by this yellow-orange portion right here. If I turn this skull into a lateral view, we have the parietal bone here in the green. And if you remember, the parietal bone does come in pairs. We have the left and the right parietal bone. If we move down to the brown area, this is going to be our temporal bone right here. And also on the side, we can view the sphenoid bone just barely right around where the temple is located. If I turn this skull around to the other lateral, that's going to show the other temporal bone and the other side of the sphenoid bone. If I turn this skull like this, here is our occipital bone. Looking under the skull, we can visualize the occipital bone, the sphenoid bone once again, both of our temporal bones represented by the brown right there. Also, from this view looking under, let me turn it this way, we can view that perpendicular plate of that ethmoid bone. The ethmoid bone is going to be the hardest one to see on a complete skull. If I turn the skull like this again, we can visualize that ethmoid bone just barely through the eye socket or the orbit right here. Not to be mistaken with this bone here that's orange. If you remember, this is going to be that lacrimal bone, but right behind it is where that ethmoid bone is going to be. And that would be our cranial bones. Now moving on here, let's talk about some of the landmarks located on that frontal bone. We're going to start with the major one that I want you guys to remember. It is the glabella, which is located right here. If we were talking about a person with skin, it'd be right between the eyebrows, right above the bridge of that nose. That's that glabella. That's a location we need to know for our positioning, as well as for our central ray exiting whenever we actually do these in real life. Now moving along, we have what's called the superciliary arch or ridge. And if you remember, that's where I told you can imagine where a person's eyebrows are located. If we're going around the orbit, and we're talking about the edge here, that's going to be our supraorbital margin, also known as the SOM. That's that area right there. Now you can't see on this skull, but we also have a little foramen that's located right here. That would be called the supraorbital notch or foramen, even though it's not represented on this model right here. Then we also have up here, even though it's not visualized with the naked eye, what's called the frontal tuberosity or eminence. But the main ones I want you guys to remember is that glabella, supraorbital groove, supraorbital ridge, and the supraorbital margin or the SOM. The ridge actually has a little raised part, and the groove actually grooves inward. And whatever diagram that I show you guys, you'll be able to clearly see the groove versus the ridge. They do have a distinct difference. It's on some of the pictures on your PowerPoint as well. So moving on here, guys, we now have a frontal bone that's separate from the skull. It would fit just like this on the skull. And we're going to go over some of those landmarks once again. In the middle here, we have the glabella, right between the eyebrows or above the bridge of the nose. We have that supraorbital groove, which is the indentation point on that frontal bone. The little raised area is going to be the superciliary ridge. That's about where your eyebrows are located on your face. Then, if we go around the border of the orbit, that's going to be the supraorbital margin or the SOM. And if you remember, you can use both names. You can put SOM or supraorbital margin. If I'm turning this up, we can see that margin a little bit better, that supraorbital margin. And moving down here, we have where the nasal spine would be. That's where your nasal bone connects. It's called the nasal spine. And this area right here that I want you to remember, it's called the ethmoid notch. And it literally functions as the word says. It's a notch that the ethmoid bone actually fits into. That's your ethmoid notch. And that's the major landmarks I want you to remember for your frontal bone. Now, when we're talking about the parietal bone, not a lot of landmarks to remember, but if you remember, the main one I talked about in class is the widest point of the skull is where we call the area of the parietal tubercle or eminence. That's going to be right here on the sides. If we're looking down at the skull from the top, on the sides we have what's called the parietal eminences. That's your widest portion of the skull if we're looking down at it from this view. That's the main thing you need to remember on your parietal bones. Also that there is, of course, a left and a right parietal bone separated by that sagittal suture, but we'll go more over those sutures here in a little bit. Now, talking about our occipital bone, just a few major landmarks we need to remember. Of course, this big one, the hole in the middle, is going to be that good old foramen magnum. Another one I want you to remember, guys, is right here, and here is what we call the lateral condylar portion, or the occipital condyles. And that's important if you remember. That's going to be what forms our atlanto-occipital joint, where the atlas of the C-spine connects to the skull. Very major piece of anatomy. And we also have a little protuberance here that's called the external occipital protuberance, or the inion. Not to be confused with the gonion, that's the inion. Now, if I show you this occipital bone separated from the skull, it looks like this. And we got those same landmarks. The foramen magnum is that big hole in the middle. We have those occipital condyles here and here. That's where that formation of the atlanto-occipital joint is, where our atlas connects to our skull. And then that little protuberance right here, it's like a little bump on the back of your head on some people. It's called the external occipital protuberance, also known as the inion. Now, of course, we're going to move on to our temporal bone. If you remember, on the temporal bone, it has a major piece of anatomy here on the side that's called the squamous portion of that temporal bone. And the reason that's so important is that's the most injured area on a skull, where a lot of skull fractures occur, because it's a very soft part of the head, that squamous portion. Moving down, we have our zygomatic arch. And if you remember, the zygomatic arch has two parts. First half is the zygoma. Second half is on the temporal bone. But as a whole, it forms a zygomatic arch. Now, if I was pointing to this by itself, you'd still put zygomatic arch. But make sure you specify it's going to be the zygomatic arch of the temporal bone, because technically that portion is connected to our temporal bone. Moving down, a little hard to see. This hole right here is our EAM, external acoustic meatus. That's your ear canal. We also have the mastoid tip, or also called the mastoid process. And this area above the tip is going to be the mastoid portion. And that's important because that's what houses our mastoid air cells. And finally, the other piece of anatomy I want you to know is that styloid process, that sharp little point coming off that temporal bone. And once again, remember, the temporal bone does come in pairs. There's a left and a right. So you got to specify whether it's the left or the right. And if I'm pointing that anatomy, of course, don't just put EAM. Put EAM of the temporal bone, styloid process of the temporal bone, etc., etc. Here's a temporal bone that's been separated from the skull, what it looks like. It would fit in right here. Just go over that anatomy again. Here is that zygomatic arch of the temporal bone right here, followed by the EAM, which is the ear canal, the styloid process of the temporal bone, the mastoid tip or process of the temporal bone, mastoid portion, which houses those air cells, mastoid air cells, and of course this big area is going to be that squamous portion, which is the most fractured area of the skull, temporal bone. And one thing I forgot to mention, guys, make sure you remember with the temporal bone is where the petrous ridges are located. I talk a lot about the petrous ridges, how they're important for positioning. Those petrous ridges are located on your temporal bone, but you can only see that if the temporal bone is separated or through an x-ray. But that's a very thick portion of the skull where a lot of radiation will penetrate and we'll be able to view it very well. But those petrous portions are very vital for making sure we've positioned the head correctly. So remember, the petrous portions are located on the temporal bone. Now let us move on to the sphenoid bone. And this is the one with all that anatomy, if you remember. Sphenoid bone is very important, not just for me, but for registry purposes. They do love to ask a lot of questions on that sphenoid bone. In conjunction with a full skull, we can see this sphenoid bone through the orbits. That's that red portion you see through the orbits right there. If I turn the head to the side in a lateral view, we can see the sphenoid bone right here where the temple would be located on a human being. And if I turn the head up we can get a nice clear view of that underside of that sphenoid bone right there. That's that bone that looks like a bat, and it's right in the middle of that head. It also contains that good old sella turcica that I love to talk about so much, and some major foramina where some certain cranial nerves are going to pass through. So very important bone, a lot of anatomy, but we're going to review that separate from the skull because you can expect that I will have a model of this on your tests. But let's review some of these portions together to make sure that we understand them quite well. All right, let's go over our sphenoid bone anatomy, one of our cranial bones. So starting from the bottom here, guys, we have those pterygoid processes. We have two medial pterygoid processes. They're the most medial portions of those. On the bottom of that medial pterygoid process is what we call the pterygoid hamulus. That's a little point on the bottom of those medial pterygoid processes, the pterygoid hamulus. Moving laterally, we have the lateral pterygoid processes on each side of that sphenoid bone. We also have the greater wings, represented left and right of the sphenoid bone here, greater wings, and the lesser wings on top, here and here. These are going to be our lesser wings. So greater wings are the big wide portion. Lesser wings are the tiny ones on top that come to a point. Right here in the center is going to be our sella turcica. If I turn this sideways, try to get a good view here, you can see that sella turcica dips down. We have an anterior and a posterior clinoid process. The anterior is in the front, anterior clinoid process. Posterior clinoid process is in the back of that sella turcica. Anterior, posterior. Moving down, we have the dorsum celli, which is right below. Turn it this way. Here's our posterior clinoid process. Down here's the sella turcica. Moving down is the dorsum celli, followed by the clivus at the very back of that area of the sphenoid bone. If we look down in the sphenoid bone like this, we can see some of those foramina. We have three major ones on each side of that sphenoid bone. We have the foramen, we have the foramen rotundum at the top, followed by the foramen ovale. Foramen ovale is actually oval-shaped, and the tiny one is the foramen spinosum. Foramen spinosum. So foramen rotundum is a round little hole at the top. Foramen ovale is the oval-shaped one in the middle, and the foramen spinosum is the tiny one at the bottom there. Now let us talk about our ethmoid bone. That's that small bone behind the lacrimal, right here through the orbit. It contains our bony nasal septum, also known as a perpendicular plate. But here is an example of an ethmoid bone. It's quite small. It has those nasal conchae on there, but I don't need you to know that. Your nasal conchae are located right here, but you don't need to know that as far as labeling. The ones I want you to remember, guys, if you remember, we have the crista galli at the top, which is a little hard to see on this little model, but whenever we do a x-ray and we have the proper angulation of the face, it'll actually stretch that crista galli out and it'll look like a long point coming to the top, the crista galli. Now right below the crista galli is a flat little surface, and you can see a little better on your PowerPoint. On the diagram I gave you, it's an area called the cribriform plate. So you have your cribriform plate and the little point on top called the crista galli, which elongates when we angle the head. And then you have, which you can't see very well on this model, that perpendicular plate going down the center that forms our bony nasal septum. And we can see that on this model. That's that area right here. This is the bony nasal septum right through the nose. That's that perpendicular plate, also known as the bony nasal septum, going through there.